Hello, what's up? I had to make sure I wasn't muted because, darn it, I wasn't starting off that way. How are you guys? I almost said happy Monday. It's Thursday. Good grief. What is wrong with me? I'm good, except I don't know what day it is, Flash fan. How are you? I hope you are feeling better. Hope your leg is feeling better. And whatever, your cut, whatever it was, hope's all good. Hello, Lauren, Michigan. Sorry. I couldn't help it. It was good to see you. Gabby, how are you? Gosh, Gabby, I haven't talked to you in like 2 days. What's happening? What's happening? Quick question. Am I still up for reading potential trial transcripts? Um, yes, depending on how much there is, because I know you've got some big trial transcripts. So we'll talk. How's that? Because I have I need you to message me, Flashman, and tell me when, remind me when that next hearing is for the guy, the cold case in Nebraska, please. Because I meant to message you today and I was busy and I didn't have a chance. Hey, Kelly, how are you? Are you back home safe and sound from your outing and your trip to see your grandchild? I don't know what's up with that, but maybe that's why I thought today was Monday for some reason. Rude. So, next week, just a preview. um, I will be here Monday, Tuesday, Thursday again. Wednesday is my dad's 84th birthday, and so we will be taking him out to dinner. He and I went shopping for flowers today. We do every year right before Mother's Day because my mom's birthday can fall on Mother's Day. His birthday is right after my mom's birthday, so let's try to go and take him out and have some fun. So we go to the same place every year. It's always a good time. Um, I don't know about that, but probably. So I won't be here Wednesday. And Thursday, we're going to jump off of Broderick trial for the Chadester sentencing. That is the grandma up in Michigan, the drunk driving grandma that drove into the boat club and ended up unaliving 2 children and hurting many others. We watched her trial. Obviously, she was found guilty. There's video footage of her doing the act, driving and drinking before she drove. So it was kind of a really easy case. It was interesting because the footage was crazy. So she will be sentenced on Thursday. So we'll cover that Thursday night, and then we'll get back onto the Broderick trial. Hey, Ronnie, how's it going? Okay, Flashman, we'll have to just look at him. Home couldn't come slower. Oh, Kelly. But look at you though. You're just doing stuff and it's I'm proud of you. Happy birthday. Yep, my dad's gonna be 84. Doesn't look a day over probably 70. So still he's still active and all that good stuff. I do not know how long the Manson trial was. I do think I might have been alive, but barely. Barely. If I was. I don't know because I don't know what year that took place. Thank you, Flash fan. Thank you, Gabby. Oh, nope, I wasn't alive. Surprise, Flash fan. I was not alive. I know it's shocking. So, if you're just joining us, we are time traveling back to 1991. This is the very first trial I ever watched on Court TV, and I think Flash fan said it may have been the very first trial the court TV ever showed. So this is actually the retrial of Betty Broderick. She had basically a hung jury in her first one. So they couldn't decide. I think they were divided, when I read it, they were divided between the unaliving charge, or as I call it, the man stuff charge. You can figure out what the stuff is. It's not gross. This is the second trial. Sorry. Pam Smart, another winner. Oh, thanks, Ronnie. So she is on trial for allegedly, I don't know that I have to say allegedly, but I will, of unaliving her ex-husband and his new wife of 6 months, Linda, after, I don't know that she broke into their home because I think she used the key. She had a key. They held up, remember the giant key ring that they keep holding up from the 80s that all the girls had? So I don't know that she broke in. I don't know where she got the key. I am assuming from one of her kids. And then went upstairs. She says to self-delete in front of them for all their crimes against her and how she was just horribly treated and everything else. And for whatever reason, she ended up emptying the gun into them. And she didn't have enough for herself, but the state said she had more ammo in the car. So I don't know. Oh, I'm sorry, Ronnie. Hey, if Puddletown was here, I think he might have been alive too. Maybe. He might have been pushing it. I don't know, Kelly. I don't know. Don't have the first trial. So today will be, I think, I'm going to call it our last, not as interesting day, because after this witness, we get to their oldest daughter, Kim Broderick, will be on the stand. And she's on the stand. We'll watch her her direct examination, and then they have to call a witness in out of order. So it's one of the divorce attorneys. I don't know whose. And then Kim will be back on the stand for 2 more days after that. So she wasn't on the stand for like 3 days, but for us it is. So we at least have her for that. And I think then we're going to start getting into the friends, housekeeper, and things like that are going to paint more of the picture of what we're trying to figure out in this situation, because Betty paints herself as the victim. She couldn't get attorneys. What state says that's not true. He took all her money, but what the state says she's getting $16,000 a month in alimony, plus I think another $1,500 in support. I don't know if it was child support. Plus she had a $650,000 home, which at that time I can tell you was a nice house. I'm not saying it's not a nice house today, but you don't get as big a bang for your buck today. She was still taking trips. I don't know how exactly she was suffering, but she was, apparently, according to her. It's horrible. I think she just got pushed over the edge, is my honest opinion, and she ended up where she ended up. Yes, I do too. I do believe that their relationship was pushed in their face. Like I said, Linda was the younger and prettier model. She was 21. Betty and Dan were pushing 40. Betty had 4 kids. Betty just wasn't 21-year-old Betty anymore. It happened. But yeah, I think he did have an affair with her. I think she knew he was having an affair, and I think the whole time it was I don't think she was exactly very stable altogether because of things that I've kind of read and picked up on. There was some stuff happening, and so I don't think it took much of a push to just, let her go cliff diving. Am I going to be up streaming during midnight on Tuesday? Uh, no. Why would I be? Why? Why would I be up at midnight streaming? That's when YouTube tells me to stream. That's from midnight to 2 a.m. This is the best time for me to stream. Like, I'm sleeping. Yeah. Hey, Nidowow. I was thinking that too when we were watching last week, that there could not be much age difference between Linda and their oldest daughter, and that would be weird. Like, I mean, I guess they could be BFFs or something. I don't know. Hey, Haley Mouse, how you doing? It was a joke because I was here till 9. Because hey, that was like almost a 4-hour stream. That was ridiculous. I haven't done one of those in a long time, and I crashed right after that. Hey, Baker, Gabby can do it. She can do it. She won't, but she could. I thought I was going to have Carmen available next Wednesday because not that she wouldn't be invited to my dad's birthday dinner, but she doesn't live here, but she has to work. I got her Wednesdays mixed up. So I was going to see if her and Gabby would stream. I don't know if my camera's going blurry or if my glasses are fogging up. Baker, I thought you were going to break your, I don't know, something today during the Reed trial. when Alan Jackson was cross-examining whatever his name is, Buchanan, whatever, don't care. And he got the cop dementia that some of them seem to get when the defense starts cross-examining them. Hey, back in the day, that would have been true. That would have been true. Bullcam? But I that was very obvious today. I was laughing because you guys, I wasn't laughing at you guys. I was laughing with you because you guys were trying so hard to hide your anger, and I understood it. But I wasn't sleepy and getting probably hangry and tired like you were. But yeah, it is something. Yeah, she won't be here, Gabby. So we'll just. I was not Flashman. Stop trying to cause problems. Also, Baker, I know you won't stay around and you won't stay awake because you need to go get some sleep because you did look really, really tired today. Not in a bad way. You just looked exhausted. But this testimony today from the medical examiner has life-size Bender dolls, a man and a woman. So imagine how they could have explained the pendulum, but they won't. So I will warn you guys again, we have seen most of the pictures. We saw them last week when they were going through the crime scene photos and they were showing some of the autopsy photos. We are going to watch the medical examiner. He has those same photos. I don't know that there's anything different or more graphic than what we've already seen. But I just know that most of us aren't used to seeing those things anymore because they don't show those things. And this one does. It shows all the things. And so just be aware because that's all they're going to be talking about today. And I'm sorry, this guy and his voice, it just makes me giggle. I don't know why. I have no idea why this guy, I don't know, but he reminds me of Ron Swanson from Parks and Rec. And so I'll just, it got him boosted, so just let me know. No, no. No, you look tired, like you needed to go to sleep. There's a difference. There's a difference. You looked exhausted. So let me know how the sound is, but I will be over here giggling because this guy makes me giggle. I don't know. What is a 1969 accent? Flash fan? Groovy. I don't know. I don't even know. What the heck is that?
Good afternoon, Doctor.
Good afternoon. Sir, could you please state your full name for the record and spell your last name?
I'm Dr. Christopher Swalwell. It's Swalwell.
Thank you, sir.
Good afternoon, Dr. Swalwell. Where is it that you work?
I work for the Office of the Medical Examiner for San Diego County.
In what particular capacity?
I'm a deputy medical examiner.
How long have you been so employed?
I've been there for about 2.5 years.
And can you give us a brief synopsis of your prior professional experience?
Sure. First of all, I'm a doctor. I have an MD degree. After graduating from medical school, I did an internship. Then I did a residency training in the field of pathology. After that, I did additional training in the field of forensic pathology, which is that aspect of pathology that I'm practicing as a medical examiner. And I've been doing that exclusively for about 5 years. Prior to coming to the office here in San Diego, I was at the LA County Medical Examiner Coroner's Office.
How long did you work there, sir?
I was there for also about 2.5 years.
Is there a board certification for forensic pathologists who have attained a degree of expertise?
Me too, until I heard a squeak and I was like, oh, the squeaky chairs are back. The good audio's here, but you can hear everything. Deep breath. I should have fast forwarded through this part. Sorry. Some people might want to know.
Yeah.
What is that?
Well, all the medical specialties have a board for which you can be certified if you meet the requirements. And basically that means, number one, that you have to take an approved training program, and number two, you have to pass an examination that's given on a nationwide basis.
Doctor, are you board certified?
Yes, I am.
When was that?
Well, I was board certified in the fields of anatomic pathology and forensic pathology back in the fall of, I believe it was 85. And in May of 87, I got my boards in forensic pathology. So I'm actually board certified in 3 different areas.
Is a primary portion of your duties as a deputy medical examiner for San Diego County the performance of autopsies?
Yes, that's certainly one of them.
Can you tell us what the autopsy procedure entails?
Sure. Basically, the autopsy is divided into 2 parts, an external examination and then an internal examination. In the beginning, we may photograph the body, x-ray it, do other things that may be necessary, remove clothing and so forth. Then the body is examined from head to toe, looking for identifying features, looking for anything unusual, anything characteristic, any kind of injuries. And then we go ahead and open the body up and actually examine the body cavities, meaning the chest cavity, the abdominal cavity, the neck, and the head.
Did you perform such an autopsy on the body of Linda Broderick on or about November 6, 1989?
Yes,
And that was in your capacity as a deputy medical examiner for San Diego County?
yes,
Did you determine a cause of death for Linda Broderick?
yes.
What was it?
She died as a result of a gunshot wound that went through her chest.
Did she have another gunshot wound as well?
Yes, she did.
And where was that?
She also had a gunshot wound that went actually into the head. It went in the back of the head and went into the brain. And that also was part of the cause of death.
What was Linda Broderick?
Okay, because you can't tell the order of the that that they hit somebody. I would think that one, I would say, was most likely the cause of death, but that's just me. You're too lazy to type what you want to say. Flashman told you Gabby loves flying because of the TSA cavity search. That's hilarious. And Baker, they're changing something with the ads on the 12th. I don't know what it is. I have mine set to just, like, if I had to manually insert them. That's, yep. And so I don't have any idea what's going to happen. I can't control it. They're going to do what they want to do. I just wish they would just make everything work. That's why Puddletown likes flying.
Wearing when you first started your examination?
She was wearing a pair of pajamas.
Two-piece?
Yes, short.
Now, I would like you to be good enough to come down for a second and assist us here with this photographs. Your Honor, we have two 11x14 photographs of appears to be a female body mounted on a single poster board. May that be labeled People's Exhibit 38.
So, Mark.
Thank you. Swalwell, I'd like you to stand over to the side so all the viewers can see. I'll give you a pointer here.
Okay, so I do not think that Linda Broderick's breasts are exposed there. I tried. I tried. I showed it to somebody else. I don't think they're exposed. I do think she's covered. So we're not looking at boobies, okay? They were respectful of that. But this is what we're going to be looking at. No, it is not, Baker. It is not. It's a back. Nobody was hit down there. But I think they have stuff over the front of her. We will not see any lower. But we will be looking at her pictures and his pictures, and then the dolls, so they can put the arrows through them to show us how the projectile went through them. I don't know what's happening. Something's happening with my camera or my glasses, but I can't see. Or I'm blurry. I don't know. Okay.
Now to do, in that particular exhibit that I just announced, the photographs A and B show the body of Linda Broderick in terms of her at least trunk area, both front and back.
Yeah.
Now, first of all, how do you, does she exhibit any bullet wounds in those particular photographs there?
Yeah.
How can you tell if somebody's a bullet?
Well, bullet wounds are pretty characteristic, and depending on whether they're an entrance or an exit, they'll have different characteristics.
Could you enlighten us on that, please?
Well, an entrance wound is generally a small, round, circular, or oval hole. It will show thin abrasions around the edges of the skin, and it may also show other changes, soot or gunpowder, if it's close enough between the gun and the body.
Now let's let's concentrate first on the chest wound that Linda Broderick suffered. Can you point out the entrance wound of the chest wound, chest gunshot wound?
Yes, this is the one that's in picture A, and it's the one hole that you see that's on the upper left chest.
And was there an entrance wound for that, or exit wound for that particular gunshot?
Yes, there was.
Where is that depicted?
That's depicted in B, and it's this hole that you see that's on her right back.
Now, turning back to the entrance wound there as to her chest gunshot wound, was there any powder stippling, tattooing, or other indications of gunshot residue on that entrance wound?
No.
And what, if anything, does that indicate to you, Doc?
Well, it indicates to me that this was not a real close range or contact type wound.
If she had been wearing pajamas, as she assumably was, so would that have affected the occurrence of any tattooing, stippling, or powder residue on or about the entrance wound?
Possibly, yeah.
Based on the fact that she was wearing pajamas when she was shot, and you found no residue, what if anything, does that cause you to conclude regarding how far away the gun was from Linda Broderick's body?
Well, what it means is that, as I said before, it's not a close range or contact type wound.
Can you give us, from what you saw during this autopsy, a minimum distance that the muzzle of the gun barrel would have been from Linda Broderick's body when she was shot in the chest?
Well, generally, and this is just kind of generally, it depends on the individual weapon and ammunition. A gun would be expected to deposit soot or powder in the form of stippling up to maybe a foot or two from the barrel, the distance from the barrel to the skin. So in the absence of that, it means to me that the distance was greater than, say, a foot or two.
And let's say if the gun used was a 38 special loaded with plus P Hydroshock hollow points, would that alter your opinion in any respect?
Well, not really, because I'm not a firearms expert.
Okay. And you would defer to the opinion of a qualified firearms expert?
If anybody needs 1.25 speed, it's this guy. He could probably even go at 1.5 speed and we'd still be okay. I mean, I would hate to see him actually like excited about something. You can see his wife being like, I'm pregnant. And him being like, oh, wow. But he's really excited. I can't, Gabby. If I could speed this up, I would. But I can't. I don't have the option on these archive streams. Trust me, I would have done it a long time ago. Because he, like I told you, he would. If paint made a sound when it dried, it's this. He just. What's up, Zach? Oh, yay. Milk money. Thank you, Zach. Also, it's raining out there, so when you come up on that Greencastle exit, don't slide by it. But thanks for the super chat. Appreciate it. Whoopsies. Sorry. Yes, Court TV is just laughing at us now. Yes. Nope. I've looked, Flash Fan. I have not found it. If you know the secret, let me know. Little Bon Jovi reference there. Because I will gladly speed this guy up.
Right. The best way to determine that would be to actually test fire the weapon.
Okay. And you didn't do that, did you?
I did not do that.
Did you trace the path of this bullet after it entered Linda Broderick's chest, as you've indicated, and as it passed through the body and exited through the shoulder area that you've also indicated?
Yes, I did.
Could you tell us what path it took?
Sure. It went into the body, actually went through a part of the breastbone, and then went into the right side of the chest. It went through the right lung, came out the back between the ribs, fifth and sixth ribs, as I recall, and then went through a part of the scapula or shoulder blade bone, and then came out here, as you see, on the back.
Now, the rear head wound, can you tell us if there's an entrance wound there for that? I think you already have, actually. Was there any powder stippling or tattooing or residue found in and around that particular entrance wound?
No.
And now you're referring to the wound that's shown, it's back of her head on photograph B in front of the jury?
Yes, the one you can see on B.
Does that lead you to the same conclusion that the muzzle of the gun would have been somewhere between a foot or 2 feet away at the minimum?
Yes.
Now, did you trace the bullet path of the second gunshot wound that entered the back of Linda Broderick's head?
What's up, Dill? What's up, Mad Dog? I will see you tomorrow. And maybe you tomorrow, Dill. I never know. Sometimes not. What's a hack? Oh, she sent me a video. Mad Dog was telling her some stories today. I was like, you better not be telling what we do at my house. That's just between her and I.
Yes.
And what was it?
Well, it went into the skull in the back of the head. It went through the brain stem, which is part of the brain, the lower part of the brain that connects the large part of the brain with the spinal cord. Also went through portions of the rest of the brain. And the bullet came to rest partly embedded in the skull in the right frontal region.
Did you locate that bullet?
Yeah.
How was that done?
Well, the bullet was recovered once the head is open. We cut the head, remove a portion of the skull, remove the brain, and then once that's done, we just pull out the bullet. We usually have a pretty good idea where it is because we take x-rays ahead of time.
Was that done in this case?
Yes.
And did you successfully locate the bullet in Linda Broderick's head?
Yes.
Or was it removed?
Yes.
And given to the police process and evidence?
Yes.
Now, I have a dummy here with some dowels that have been inserted into it.
I guess this would be
And this is
Vinderette.
for demonstrative purposes. The court wishes to be marked.
Mr. Early, what's your pleasure? No, Mark.
Thank you. Sometime before coming to court today, Dr. Swalwell, or this afternoon, did you take this dummy and position these dowels to correspond with the path of the two gunshot wounds, the bullets followed for Linda Broderick?
Yes, I did.
Can you, let's say, starting with the chest wound, describe that for the jury?
Okay, this here would represent the entrance gunshot wound, the same wound that you see in the picture A. And the one then on the back would be the corresponding exit wound. And the rod is demonstrating the path that bullet took through the chest.
Okay, let's rotate this around now and then talk about the bullet path for the head wound that she suffered. Please go ahead.
Okay, this demonstrates this would represent the entrance that you see again in photograph B in the back of the head. And the dowel is positioned to try to closely simulate the angle that it would be going through the skull it doesn't come out because the bullet didn't come out. So there's no exit wound corresponding to that one.
Now, if I rotate the dummy again, can you show the jury where the bullet was recovered from the inside of the skull on Linda's head?
Yeah, it basically would be the inside of the forehead of the skull that's in that location.
And it was right up against the skull wall, so to speak, on the inside?
Yeah, the bone was I'm sorry, the bullet was actually partly into the skull bone.
Thank you. Why don't you just stay right there, we'll continue on. Was a blood and drug screen done on Linda's body, tissues, blood, urine, et cetera?
Yeah.
What were the results of that blood screen and drug screen?
No alcohol or drugs were detected in her system.
Now, turning now to the fatal nature of the gunshot wounds that Linda suffered, you stated that the chest wound would be fatal?
The chest wound could be fatal by itself, yes.
Without the additional head wound?
Yes.
Would that have caused death necessarily immediately?
No.
Understanding that there's probably a range, well, why don't you tell us what the range would be with a reasonable degree of medical certainty, how long Linda would have lived after she incurred just a chest wound, assuming that she was not later shot again from the back of the head?
Well, if she had just had the chest wound.
Your Honor, we didn't have objections, irrelevant.
It's very relevant.
Overruled, go ahead.
It's very relevant, Your Honor. I don't know how he can say that that one came second, but maybe he can, and he'll explain to us. What's up, Ada? How you doing? You had a long day. Of a forgetful guy on the stand. There's some images in this, Ada, so just be aware. This is back in 1991, and they showed us all the things. All the things.
If she just had a chest wound, as I indicated before, you wouldn't expect her to die right away. What basically happens is that there's a buildup of blood bleeding from the wound inside the chest. There may be an escape of air. There's blood that gets into the airway and sort of chokes it off. And it takes a little bit of time to get to the point where that causes death. It's hard for me to say exactly, and I could only say that generally it's a matter of minutes, ranging from maybe a few minutes, 2 or 3 minutes, to as much as an extreme possibility, maybe a half an hour. So.
And during this period, would she be capable of moving?
Well, at least for part of that period, until she got to the point where she lost enough blood or couldn't get enough oxygen so that she'd pass out.
Now let's turn to Linda's head wound. Would that also be fatal by itself?
Yes, definitely.
And how long would it take for that head wound to cause her death?
Well, this is one of those wounds that kills you virtually instantly.
After she had been shot in the head, as she was, would she be capable of any further voluntary muscular movements?
No.
Would her body move at all after she was shot?
Well, the body could move passively, but not anything voluntarily.
You're talking about if the body, by way of inertia, had been presently moving when it was shot, that Linda would have probably kept on moving by process of inertia until she fell?
Yeah, by momentum and gravity, whatever movement she might have had would continue until she falls or comes to her final position.
Now, assume for a moment that the bullet that went through Linda's chest and out her back was found underneath her, that had gone through the fitted mattress sheet, and then it kind of furrowed into the mattress pad beneath that and then stopped. Is that an unusual circumstance in your professional experience? that the bullet would go through somebody's body and then hitting something rather soft or fragile like a mattress pad, it would stop?
No, not necessarily.
Why would that be?
Well, it just depends on how much energy is lost when that bullet as it goes through the body. In that kind of example, then obviously most of the energy was expended, the bullet was barely able to come out, and then wouldn't go much further beyond that.
Have you seen that situation in other homicides that you've attended?
I believe so, yeah.
Now let's turn to the autopsy performed on Daniel Broderick. Was this done the same day
Yes, it was.
as Linda's?
Yes.
And Your Honor, I'm sorry, 40. Oh,
It keeps court TV keeps flashing. Sorry. You better see. you put that chat up there, Zach, and now you got to knock at your door. You better be looking through the people. But I'm sorry. I thought it was StreamYard, but it's Court TV's site.
Actually, this has already been identified. People's 22, Sergeant Gelder identified that. But I think he only identified photograph B. Looking at all full photographs here, A through D, are you familiar with those photographs?
Yes.
And do they show the body of Daniel T. Broderick that you performed the autopsy on 11/6/1989?
Yes.
What was Mr. Broderick wearing when he was examined by yourself?
He's wearing only a pair of boxer shorts.
What was his cause of death?
He died as a result of a single gunshot wound that went through the chest.
And looking at People's Exhibit 22, can you point out the entrance wound of that gunshot suffered by Daniel Broderick?
Yes, it's actually demonstrated in two of the photographs, C and D. It would be the circular hole that you see in C and the hole in D that you see the rod that's going into.
Now, was there any powder, stippling, tattooing, or other residue around that entrance wound?
No,
And would that lead you to the same conclusion that the muzzle of the gun therefore must have been at least 2 to 3 feet away or farther?
yeah,
Did you trace the bullet path of the gunshot wound that Daniel suffered?
yeah,
And can you explain that to the jury, please?
sure. In this case, it went in the back. It fractured through one of the ribs, the 9th rib, before it went actually into the chest cavity. It perforated through the right lung and then came out the front of the chest and the shoulder area between the first and second ribs, and made a hole as you see in photographs A and B as the exit.
Now, looking at photograph C, can you tell us what's depicted there, please?
This is the entrance gunshot wound.
I'm sorry, I'm looking, photograph D, actually, I mean.
Okay, D again, as I said before, shows the entrance. In this case, it has a metal rod going into it that was placed to simulate the direction that the bullet took through the body.
And as you did with the model that stood in for Linda Broderick, did you similarly place a dowel to show the bullet path or trajectory for Daniel Broderick?
Yes, I did.
Granted, we have another one of these foam models with a dowel. I'd like to have it there used for demonstrative purposes, not be labeled.
Mr. Earligan, you have no objection?
All right, go ahead. I'll hold up in front of the jury here another foam model, this time a male model with a wooden dowel. Can you explain to the jury what you have here?
Okay, this is a reconstruction of the path that the bullet took through the body. What you're seeing from the front is actually the exit that again is depicted in photographs A and B. The entrance is on the back where the dowel actually goes in on the right back.
So in this case, the bullet was moving up towards the shoulder.
Yes.
Now, Daniel's gunshot wound that he suffered, would that have been immediately fatal?
No, not necessarily.
Would the same process have taken place with him as it would have with Linda's had she not been shot in the head?
Yes.
He also would have been capable of living from any time up to approximately half an hour in the extreme.
Yes, it would have been about the same time period as I described for Linda's.
During that time period, if he had medical intervention, could he have possibly been saved?
Yes.
Can you give us any instances of other, maybe more notable gunshot situations where that's been done? Where somebody has suffered a gunshot wound to the chest?
Your Honor, objection. Conclusion, speculation. Well, he's an expert in the field. If you can answer that, if you can, Doctor.
Well, the example I usually use is President Reagan. He was shot in the chest and the bullet went through the lung, but he survived. Of course, he got immediate medical attention.
Did your autopsy show that Daniel did indeed live for a period of time after he was shot in the chest?
For some time, yeah.
Was this due to the fact that he had blood in his airway and he had also some amounts of blood in his stomach?
Yes.
What does that indicate to you, Doctor?
Well, he had blood in his airways that actually went down into his lungs, which indicates to me that he was actually breathing that blood in, meaning that he didn't die instantly. He at least took some breaths. Same thing with the blood in the stomach, at least swallowed a small amount of blood into his stomach.
Okay. That evidence doesn't tell you how long he could have lived, does it?
No, it does not.
Okay.
Just for you, Gabby. Magic 8 Ball, Magic 8 Ball, Magic 8 Ball, Magic 8 Ball. It's safe to Google it, Haley. Just Google Nibby the Diva Beaver. It's not bad like it sounds. Promise.
I want to show you one other photograph taken at the scene of two homicides. And this exhibit has already been labeled and sponsored as People's Exhibit 8. I want to draw your attention, Doctor, to one particular photograph, and that is photograph D, right at the top here. Assuming for a moment that Daniel Broderick's head was right about where this blood and this foamy stuff is up there. Does that in any way aid you in showing that he was alive for some period of time?
Well, yes, in that there was this foamy liquid here, and foam is a product of air and liquid, and it means that he had liquid in the lungs, but he was also breathing air into that, so it gets mixed together and produces foam.
Now, if a witness of the scene testified that there was actually more foam here than appears in the picture when it was first discovered and before it was photographed, would that indicate to you that he lived even a longer time than what's shown here in this picture?
Yes.
after Daniel was shot, would he be capable of, let's say,
Can you resume the stand?
yeah, sure, thank you. Would he have been capable of, let's say, sitting up?
It could have been, yes.
Would he have been capable of, let's say, reaching for a phone on the nightstand near where he lay?
Yes.
Would he be capable of having of speaking to people for at least a limited period of time?
It could have been, yes.
Did you note any injuries to the outsides, in other words, where the knuckles and the outside of the fingers are of Daniel's hands?
Yes.
What did you see there?
On the right hand, he had several abrasions or scrapes on the back of the middle ring and little finger.
Any others?
No, I think they were confined to those three
Okay.
fingers, as I recall.
Would they have been consistent with him being struck with some sort of hard or rough object?
Struck in the sense of a glancing blow. It could be,
Kind of a swipe, would that be more accurate?
yes.
Now, did you also perform a drug and alcohol screen for Dan's blood, urine, other tissues from his body?
I did send blood and tissue urine to be examined, yes.
You didn't personally do it, but there was a lab that did it for you.
Yes, the lab within our office.
What were the results of that?
He had a .04 alcohol level in his postmortem blood.
What about in his vitreous humor?
There was a .07 level of alcohol in the vitreous.
What does that tell you, the difference between those two figures?
Well, what it indicates is, first of all, that you have to know that vitreous, the values in the vitreous tend to lag behind the values of the blood because there's a barrier between the blood and the vitreous. So it tends to indicate that at some point in time, his blood alcohol level was higher.
And at the time of his death, what would it be?
Well, the blood level that I quoted would be the one that's the best representation of what his alcohol was at the time he died.
And that would have been 0.04%.
Right.
When you did you examine Daniel's liver?
Yes.
And were there any physical abnormalities in it that you could see?
No, nothing significant.
Was there anything in your entire examination of Daniel Broderick's body that would have indicated that he was either alcoholic or abused alcohol?
Your Honor, objection. Rule, can you answer that?
No, I mean, other than the fact that he had alcohol in his blood at the time he died, there wasn't any other stigmata of chronic alcohol use.
Thank you. Linda, let's go back to Linda for a second. Linda's chest wound, how many inches from the heart did that bullet pass by?
I didn't actually measure it at the time, but going back and reconstructing it, I would estimate it came within a couple inches of the heart.
And as to Dan's chest wound, how many inches from the heart did that bullet pass?
That one I would say is about the same, maybe a couple inches.
Now bear in mind that we've used some foam models and we had a picture here. Could you show the jury on my body where where Linda was shot in the back of her head? I'll just stand up here and you can just point.
Would you like me to point with my finger or the pointer?
Whichever's cleaner.
Okay, it would be approximately in this area here where I'm pointing to right now.
And would you point to the back of my body where Daniel Broderick was shot in the back?
Okay, that would be somewhere in the region of the right back, but in the middle, but very close to the midline.
Thank you, Doctor. I have no further questions.
Cross down.
Sir, you have some training and expertise in alcoholism.
dear Lord, please don't tell me we've got an hour of this guy asking questions. No. The only thing you missed, Daddy Shortnuts, was the two mannequins over there. One that's leaned up against the books, and the other that's I don't know what she's leaned up against. That's it. There were some jokes made in chat about them. That's all I can say. Other than that, you've missed nothing. Nothing. But you came in at the best part. This guy's super great questions.
As I have in the pathology of alcoholism, yes.
Obviously, you can have somebody who's an alcoholic who doesn't have any obvious signs of it, is that correct?
That's correct.
So when you have people who have, for instance, been convicted on a number of occasions.
Objection,
drunk-
Your Honor.
You open the door. I can cross-examine.
Are you asking a hypothetical?
Yes.
Based on facts not in evidence sustained. I've heard the evidence of been convicted several times of alcoholism or alcohol.
I'll make an offer of proof, Your Honor.
Fine, make it. Go ahead.
Sir, do you have any, through your training and experience and your studies in your field, have you developed any other expertise on determining if someone is an alcoholic other than internal examination of their organs?
Well, my expertise is confined to the field of pathology, which basically would be, in addition to examination of organs and tissues, laboratory tests.
Well, in the field of pathology, you also, to be able to make some determinations, you also have to do some studies of human nature, do you not? Have to have some knowledge of human nature?
Objection argumentative.
Sustained.
Well, for instance, to be able to determine how someone would move and how far they would move and what they'd be able to do. It's more than just working in a laboratory. You have to have some knowledge of human nature, do you not?
Same objection.
Sustained, I don't see the relevance of that. He said that his expertise is limited to the examination of the body
Well,
parts.
sir, but you also render an opinion, for instance, what's likely or not when someone will move and when they won't. Isn't that correct? You were asked that opinion. You were able to render that as an expert, were you not?
Yeah.
Objection, Your Honor, it's argumentative that it doesn't have anything to do with human nature.
Sustained.
Well, Your Honor,
You want to ask me questions about his field of expertise? Go ahead.
sir, when you render an opinion about what is most likely, you don't do an experiment with dead bodies in the pathology lab and determine what's likely, do you?
Generally not, no.
Okay, so when you're talking about when somebody can move and when they can't move and when they're shot and when they're not shot and how far they'll move, some of that is based on information you get from detectives and what has happened in other cases where you weren't present, isn't that true?
Yes.
And you've testified before in this case that you have to take into consideration the condition of the person's body, the condition of their health to determine how long they may live or whether they may move or not. Isn't that correct?
That certainly could be a factor, yes.
And in the area of pathology, it's not just the working with bodies, but you also take into account how human beings respond in different situations to help render your opinion, do you not?
We may.
And so, for instance, when you say someone may move and may not, that's because depending on the situations, people will do different things. Is that correct?
Objection being.
Overruled, answer that.
Well, that's part of it. Obviously, there's multiple factors involved, and that may be one of them.
Yeah, and that's something that you obviously consider when you render an opinion as to what's most likely or probable, isn't that right?
Yeah.
Do you go to the scene of homicide generally when you perform in your work, or you usually in a laboratory?
We try to go to the scene when we can.
Okay, did you go to the scene in this case?
In this case, I did not.
And during the when you talk about probability of whether someone will move or not, have you ever heard of the term emergency response syndrome? Fight, flight.
Fight or flight, yes.
Okay. So depending on how the person is, what's going on with them, physiologically and in their mind, you see cases where some people, where you would expect most of the time they wouldn't be able to move, they actually do move.
Objection beyond the scope.
Overruled. It's possible, yes.
I mean, have you heard of cases where people are stabbed in the heart where you would expect them to drop, but you hear about them moving 10, 15, 20 feet?
Yes.
So sometimes you have to get outside information to be able to determine what's likely and what's each particular case. Is that correct? To take it out of just a range of probabilities.
Right, in order to be more specific about an individual case.
So when you indicate that somebody is not doing voluntary movement when they're shot, that doesn't mean that when somebody is shot, for instance, their spinal cord, that they might not continue movements that they were already doing. Is that correct? In other words, if somebody is running, they might get shot in the back of the head or sever their spinal cord, and they might still take a step or two, continue the movements that their body was already doing.
Yes.
Okay. So while we say voluntary movement is ceased, the movement that the body is already doing may continue. A person may move a few steps, they may be turning over, continue to turn the movement they've already started. Is that correct?
Yes, as I indicated earlier, these are more a phenomenon of momentum and gravity, and there may be some reflex actions that cause movements as such.
Okay. So somebody who obviously is running or moving away from something and then gets shot may continue that movement as a reflex movement or momentum. Is that right?
Yes.
In this case, you weren't able to determine, there was nothing there that told you, you're not able to determine whether the person had some of the reflex movement or momentum continue their movement, where there was no information that you had that said that this was, for some reason, a person that could not have done that?
What difference does it make if they moved or not afterwards? If he moved, does that make Betty wasn't in the room? Is that what that means? Where's he going? I feel you, sir, up there. Mr. Swalwell, Dr. Swalwell. That's kind of how I feel right now. Yes, if he does move his lips too much, the mustache will fall off. Maybe he is trying to get him to talk normal, but I think this guy is smarter than that attorney.
In other words, it's capable in everyone with this kind of wound.
It's possible, yes.
Okay, so in this case, was there any evidence that told you that that did not happen in this case from your examination of the body?
Well, I would have no way of telling just from examining the body.
Okay, so it's not that the wound was, if it would have been because of its attack location, you can say that there's never any reflex in these kind of wounds, or never any kind of momentum movement.
Well, that's correct, but you have to understand we're talking about something that's going to occur in a very brief period after the shot.
Okay, we're not talking about someone running a 100-yard dash, but we're talking about someone running, they might go an extra few feet or continue one more step. That's what you're talking about.
Yes.
Okay. Now the wound to Daniel Broderick, that was through and through, is that correct?
Yes.
Now there are wounds that you see to people that where the bullet goes, breaks the skin and can fall out, but it's not a through and through wound, isn't there?
Well, I think if I understand what you're getting at, is there are instances where the bullet may partly break through the skin, maybe just underneath the skin or partly hanging out, and then sometime later fall out.
Okay.
That's, yes, certainly.
Okay, and you can tell there's a difference in the kind of exit wound between those wounds and the one you saw in this case, is that correct?
Not necessarily.
And what do you mean by not necessarily?
Well, once the bullet completely falls out, it's completed the hole, so to speak. And I may or may not be able to tell in a particular instance if the bullet came out immediately or sometime thereafter.
In, I remember testifying in a previous trial in this matter,
Yes, I do.
and you remember being asked in this trial whether this wound appeared to you to be a wound where the bullet went through the body and kept traveling after it left the body.
Yes,
And you remember testifying that that's what it appeared to be to you.
that's what
I
I
ask
said.
counsel, excuse me, I ask counsel for a reference and we get the witness opportunity to look at the transcript. 112.
There was at least this wound was there something that made,
At the time, then,
well, that was more closer to the time of the incident, is that right?
yes.
Is there something that's made you change your mind and say that the bullet was not one that traveled through the body and kept traveling after it went through?
Yes.
What's that?
Well, in the interim, I've had the opportunity, obviously, to think about the case quite a bit and also to review close-up photographs of the wounds and discuss the wounds. And so I have a little bit different opinion, at least as regarding to the wound on Dan Broderick.
Okay, so now you testified at a preliminary hearing in this matter, is that correct?
I believe so, yes.
And at that time, as an expert under oath, you had reviewed your report, obviously, before you testified, didn't you?
Yes,
And you had an opportunity to see the pictures, didn't you? In fact, you were shown pictures, weren't you?
at the prelim, I assume so, I don't recall.
Okay, and your opinion then, as an expert, was that it was a through-the-through wound with the gun, with the bullet continuing to travel, is that correct?
I don't recall if I said that in the preliminary trial or not.
At the trial itself, obviously you've had a chance to discuss the case with the district attorney before the trial, did you not?
Yes,
Okay. You had a chance to discuss what you saw in your autopsy, did you not?
yes,
And you went through the pictures with the district attorney, did you not?
I probably did.
And you saw the pictures when you were in front of the jury, is that correct? Is that correct?
I saw at least some of the pictures, yes,
And you were testifying as an expert,
yes,
and it was your opinion at that time that it was a through and through wound. The bullet kept traveling.
yes.
Now, you've said that you've looked at the pictures again, and now you have a different opinion, and you've had some discussions.
Yes, I've had a chance to see not only the original pictures, but the pictures blown up, as you will, enlarged, which I did not have at the previous trial.
Your Honor, I would like to approach the bench and ask, I'm going to ask the court to take judicial notice.
All right, come on up.
Sir, is it your testimony? Oh, I'm sorry. The most important person.
Go ahead.
Is it your testimony that this is the first time that you've seen these pictures blown up? This is pictures of Linda Kolkena, number 38.
No, I'm not saying that.
Okay. You didn't see these the last trial, or you did?
I don't recall. I mean, I know I've seen the pictures. I don't recall what size they were.
Okay. But you testified that this is your first opportunity to see these pictures blown up, and that's the reason that you changed your mind. Is that correct?
Objection, that misstates the evidence.
Sustained.
What is your testimony? What was your testimony about what you saw that changed your mind? Was it these pictures?
No, I don't believe it was those specific pictures. What I said was that I saw a picture of the exit wound, an enlargement of one picture of that wound.
Well,
And I don't believe that that is the picture that I recall.
you've seen a different enlargement of this than this?
Yes, I believe so.
Where did you see that?
It was something shown to me by the district attorney.
Your Honor, I would ask if I could, before I finish my cross.
Sure. Just for the record, will you identify what the photo board you've just been showing?
22.
Fine.
My, did I get they were larger than these pictures?
To tell you the truth, I don't specifically recall how big it was. I'm only referring to the exit wound.
So you're referring to, either A or B?
Right.
And so these pictures you weren't able to see. There was another picture that showed you a better picture of the exit wound than these?
At least a different picture. I'm not sure.
Blown up to this size?
I don't know. I don't recall specifically how big it was.
I would like to be able to request that we have the picture now, so. It's not a problem, Your Honor. We give them a full set of, I think
It's the same photo.
No, I want to see the blown up one. There's no blown up one. Oh,
Go ahead. There's no blown up one. There's no blown up one.
uh,
Do you have a full set of the autopsy photos?
Well, I'm trying to find out where this blown up one he's talking about, we saw that was different than here. Assuming that these are the only blown up pictures. Are you saying there's different ones than this, or these are the ones?
Your Honor, there are other photographs. They are of the same thing. They may be different sizes. We have no objection to showing the council. I mean, there's 3x5, there's blown up to 8x10, there's blown up to 11x14, and there may be some others that are blown up even more. But it's the same photograph.
To make those available, Mr. Earl?
Oh, okay, it's the same photograph, that's fine.
All right.
That's fine. So there's no, you believe, are you saying that you saw a different photograph than these?
No, no. I'm not saying that I saw different photographs. I'm just saying I saw the photographs at different magnification, if you will. And I've seen other photographs in addition to these of the same injury.
So you're saying that there was one that's even bigger than this one that you saw?
I'm saying I don't recall if that specifically is the one that I examined or
Have
not.
you seen any that were bigger than this?
That were bigger,
That were blown up more than these were?
I couldn't say for sure.
But you agree that the last time at trial you saw, when you testified under oath, you saw these pictures, is that correct?
I believe so.
Okay. And you're saying that from these pictures, you weren't able to make the determination?
No, I'm not saying that.
But something changed your testimony?
Changed my opinion.
And can you tell me what that was?
Yes, as I said before, well, let me just indicate that To the best of my recollection,
He already said it. He saw an enlarged picture of the same picture that you're looking at. That's also enlarged. That the state just said they'll give you all of the pictures that are enlarged or not enlarged of all the sizes. That's what he saw. So apparently he saw something in there that changed his opinion. It doesn't change whether Betty was there or not. It doesn't matter.
that was the first time that I was ever asked that question, meaning when you asked me at the trial. Since then, I've had many months to review the case and think about it, to review the pictures, to discuss various aspects of the scene, to try to think of explanations for certain observations made on those photographs. And so as a consequence of that, I have a different opinion on that one particular wound.
So, sir, when you gave your opinion last time, you gave an opinion even after seeing the pictures, and subsequently decided that your opinion was wrong.
That's correct.
And
Or let me say it could have been wrong.
Now, when you gave the estimate in this case about the wounds, how long someone might have lived, you've indicated that a couple minutes is the most probable that you could give. I mean, that's the range that's most probable. There could be some circumstances where there's an extreme of a half an hour.
Objection, that was kind of testimony. Overruled.
No, I didn't say that a couple minutes was the most probable. I said it ranged from a couple minutes to the extreme of maybe a half hour.
I mean, hey, let's not forget, had he lived 5 minutes, had he lived 10 minutes, he couldn't call anybody because she ripped the phone out of the wall. Oopsies. I know he doesn't matter to this witness, but ugh. This guy drives me crazy. I don't know why, but he just does. He would look 12 without his mustache. He is very comfortable, isn't he, little one? Yes, allegedly ripped the phone out of the wall. We saw it in court, but now it has everybody's fingerprints all over it because they didn't wear gloves back in the day. What? Betty, why did you get heady? I don't know. It's after 5, Gabby.
So you can't say your answer, you would not be able to answer that question. We're probably talking about a matter of a few minutes. I mean, at least a minute or two. It could have been longer. You can't answer like that. You have to say that it's between a minute and a half an hour.
I'm sorry, I don't understand the question.
Well, when you're asked a question, how long would a person live? Would you start by saying that it could matter a few minutes, at least a minute or two, and it could have been longer? Or are you saying that that's not really true? It's between 1 minute and a half hour.
Well, in my own mind, I don't quite understand the difference.
When someone asks you how long something can happen, if it ranges for 1 minute to 30 minutes, normally people say 1 to 30 rather than it's probably 1 or 2, but maybe longer. Isn't that right?
I don't recall it. I said it was probably 1 or 2 minutes. I'm sorry.
Okay. Reading your preliminary hearing testimony, I'm referring to page 154. Page 154, a question that was asked, the range of time, and then your answer is on page 155.
Read it yourself. Al.
Yeah, if you can read it to yourself.
Okay.
You were just asked a question about how long someone would live, is that correct?
Right. I'm sorry. I was confused about the previous questions. I thought you were asking me what I had stated earlier in this trial, not in the preliminary trial.
Well, okay. At the preliminary hearing, when you were asked a question, your answer was not 1 to 30 minutes, but probably 1 to 2 minutes.
That's not the testimony, Your Honor.
Let me read it.
Why don't you?
Well, probably we're talking about a matter of a few minutes. I mean, at least 1 or 2. It could have been longer. Could have been several minutes. Not likely the more to be a half an hour. An hour would be the extreme maximum. Remember that answer?
Yes.
So you started out by saying probably a minute or 2. Is that correct? Or a
That's
few
not
minutes?
what he said.
The answer speaks for itself. I'll read the answer again. That wasn't what it said. Read the answer again.
Well, probably we're talking about a matter of a few minutes. I mean, at least a minute or 2. It could have been longer. Could have been several minutes. Not likely to be more than, half an hour. An hour would be the extreme maximum. That was your testimony then, is that correct?
Yes.
You indicated there was a small amount of blood that was in the stomach of Mr. Daniel Broderick.
Yes.
Okay. Now, when we talk about a person living, a person might be unconscious immediately, is that correct? And still live?
Yes.
Okay, so you don't have any way of knowing whether these people were conscious or unconscious immediately, do you?
That's correct.
And even when someone's unconscious, they continue to breathe, is that correct?
Assuming they're not dead, yes.
Okay. And so what we're talking about here, the amount of blood that you found in the stomach, was an indication that the person had swallowed once or twice?
Possibly, yes.
A lot more than that, or?
Well, no, it didn't appear to be a lot.
Okay. And the breathing that the person did as far as mixing the amount of blood, something that could happen in a very short period of time, within a minute or 2, is that correct?
Yes.
Even the amount that you saw in the photo, even assuming there could be 10 or 20% more foam, we're still talking that can happen in a minute or 2, isn't that right?
Yes.
Okay. When you show the angles of entry in a body, we're talking about during a period of time. This is where the bullet entered, and this is how it exited. Is that correct? Am I making sense? I can withdraw the question, ask it.
I'm not quite sure I understand.
Okay. When a bullet enters the body, it goes through it like this. You're not able to tell necessarily where somebody was standing, where they fired the gun, just by the autopsy itself, and where someone was standing when they were hit and you were laying or sitting.
No, I mean, not without knowing where the gun was when it went off.
Okay, so somebody, when they are moving they may be turning around, they may be doing anything, but the path of the bullet shows where the bullet hit it in that second of time, the body, is that correct?
Right, I can't even tell if the body is moving or still at the time that it's shot.
Okay. In the path of the bullets, sometimes the bones will deflect paths of bullets.
Sometimes, yes.
Ribs less likely, as the bones get thicker, they better chance of it.
Right.
Okay, so I take it there's a difference between the sternum and the ribs as to which one may deflect a path and which one may not.
Well, there's a little bit of difference. The sternum is a little bit thicker than the ribs.
And the shoulder blade?
Shoulder blade is quite thin.
Okay. And depending on what the angle is, they can still deflect, or the speed of the bullet, can they not?
I'm sorry,
Depending on how, you indicated that a bullet, when it goes through the body, how far it travels outside the body, sometimes just how much energy is absorbed by the body.
right.
Okay. I take it that the slower the bullet is traveling, the more chance that it's going to be deflected by a bone.
Yeah.
Okay. So a bullet that has a lot of energy and goes through the body and is still traveling very fast and goes into a wall, less chance of being deflected than one that's slowed down considerably in the body, almost to the point of stopping. Is that correct?
Yes.
And it was your opinion that, at least now it's your opinion, that at least on Daniel Broderick, you feel that the wound is not a through and through wound?
No, I didn't mean to say that. What I meant to say is that it could have been either way.
I have no further questions at this time.
How long are you going to be, Mr. Burkoff?
It might be a little bit, this might be a good time.
All right, we'll take our evening recess at this time. Ladies and gentlemen, please remember the admonition, and also please remember not to look for yourself on television or read about yourself in the paper. See you tomorrow morning, 9 o'clock. Have a nice evening.
Don't look for yourself
Drew,
on
I believe you have
television.
completed your cross, but you want to reopen, is that correct?
Just for very briefly, Your Honor.
All right, people have no objection?
No, Your Honor.
Go ahead.
Sir, you indicated that the wound to the back of the head would be one that would stop voluntary movement. Is that correct?
Yes.
Okay, would that stop breathing?
Yes.
Okay, and so I take it the person wouldn't speak out, wouldn't make any noise.
That's correct.
Okay, the person wouldn't sneeze,
Correct.
cough.
No.
Okay, and the person wouldn't be breathing at that point.
For all practical purposes, I mean, she may take a breath or two, but that's about it.
Okay. You indicated that there was some abrasions on Mr. Broderick that you saw on his hands. Is that correct?
Yes.
Okay. Are you able to tell what those are from?
No.
And I have no further questions.
Mr. Burkoff, redirect.
Thank you, Your Honor. Dr. Swalwell, these abrasions that the defense lawyer just talked about, were they fresh?
They appear to be, yes.
And those are the abrasions on the back of Daniel Broderick's hands?
Yes.
Now, yesterday it was suggested that you had somehow changed your testimony from that given to the last time. Remember that part of the questioning?
Yes.
Sustained.
Can you tell us, enlighten us a little bit of whether or not you did change your testimony?
Your Honor, objection argument. Not calls for conclusion.
Sustained. Just rephrase it, Mr. Burkoff.
Thank you, Your Honor. Have you changed your testimony in this case?
I'm not sure if I've changed my testimony. I said that I changed my opinion.
What is that, sir?
Well, that was perhaps an unfortunate choice of words, but I wanted to clarify something that I had said that was brought up before.
Who brought that up before?
Mr. Early.
When was that?
I'm talking about an answer that I gave in the previous trial.
Okay. And now you're telling us you want to clarify that?
Yes, in light of the question that came up this time.
Why do you feel you need to clarify it?
Well, because I think that there was some misunderstanding, or that my answer might have implied something that I did not intend.
Your Honor, objection. Motion to strike.
Proper redirect, Your Honor.
Overruled. Answer stands. Go ahead.
And can you clarify that for us, Doctor?
Okay. The question was about the exit wound on Mr. Broderick. And the original question was one of whether it was a through and through kind of injury where the bullet continued on out through the body, or whether it was a situation where the bullet might have caused a small tear and then later came out at a later time. What I answered at that time, because it didn't make a small tear, was that it went through, I believed it went through and kept on going. What I did not intend to imply by that is the possibility that the bullet might have come out partway and then fallen out shortly thereafter.
Is that a possibility? It could have happened that way?
I think that's possible, yes.
Let's look at the photograph of the exit wound here. For the record, I'm showing the doctor People's Exhibit 22. And on that photograph B, 22. Pointing to the exit wound in Daniel Broderick's shoulder, can you explain to the jury why you believe that was a through-and-through wound?
Well, because it's a fairly large hole, measured about 1/2 of an inch. And obviously, you know, at the time of autopsy, there's no bullet in him, so the bullet did go out at some point in time.
But you're saying it wouldn't be possible for the bullet to adhere to the margins of the exit wound and come out at a later time?
Yes, I've seen instances where bullets partially exit. I mean, they're halfway sticking out of the skin, and they may or may not fall out all the way at some later point.
You have no way of knowing what happened in this particular case, is that correct?
That's correct.
Now, did you look at any other photographs other than what might have been taken with that particular negative there, or the photograph you just looked at of the exit wound that weren't shown to this jury?
Other than those two there, I don't believe so. What I saw were different magnifications of those same pictures. And what confused me was that the photograph I remember seeing was actually a smaller photograph, but the magnification was the same or larger.
So again, Doctor, referring to People's 22 photograph B, you're saying you still look at the same photograph of this particular exit wound?
Yes.
It might have been enlarged, is that?
Well, it might have been larger, but the actual photograph itself was small, and that's why I was confused about when you say bigger or smaller, you're talking about the size of the photograph or the size of the magnification.
In other words, the photograph might have been cropped down to cut out the rest of the body and just keep keep the wound itself. Is that what we're talking about?
Exactly, that's what I'm trying to say.
Okay. Does this possibility that the bullet might have adhered to the margins of the exit wound, Daniel Broderick's shoulder, change in any regard your testimony about the path of the bullet?
No.
Or its fatal nature?
No.
Or anything else you testified about that particular bullet wound?
No.
Is that still the exit wound, the wound that appears in his shoulder?
Absolutely.
And has anybody at any time requested or suggested that you might want to change your opinion in this case?
No.
Now, council talked about the emergency response or the flight or fight syndrome. Do you remember that?
Yes, I think so.
Applying that to Linda Broderick after she was shot in the back of the head, would she have been capable of any flight or fight response?
No, she would have become unconscious, so she would not be capable of that.
There would be no emergency response.
Well, in the sense of her doing something, no.
And when council talked about some reflexive movement, I think were his words. Can you comment on whether or not after Linda Broderick was shot in the back of the head, whether she would be capable of any major muscular movements that would have changed her body position?
No, when I'm talking about reflexes, I'm talking about like muscular reflexes, twitches, that kind of thing, but that would not be sufficient enough to actually move the position of the body.
Council also talked about somebody running, being shot, and then continuing to run. Remember that scenario?
Yes.
But was there any running that you could see what was done in this particular homicide?
Not to my knowledge.
Not at least these two victims. Would that be correct?
Right.
And indeed, if somebody was running and they were shot, they would drop to the ground, wouldn't they?
Yes.
They continue to run like this a little bit?
Well, what we're talking about is they may take another step or two before they fall.
And that would just be the momentum just carrying them forward. Would that be
Right.
accurate?
Yes.
Now, when it was brought up, there was a little amount of blood in Daniel Broderick's stomach. Does that indicate how long or how quickly he died after he was shot in the back?
No.
And the amount of foam that was found under his mouth, does that indicate how long or quickly he died? How long he might have lived or how quickly he died?
No, not specifically.
Now, the bullet paths that the council talked about, you examined all three bullet paths, the two through Linda Broderick and the one through Daniel Broderick, did you not?
Yes.
And you testified that it's possible that bone may deflect bullets, is that correct?
Yes.
In this particular case, was there any indication whatsoever that any bone deflected these three bullets from their normal path?
No.
Why is that, sir?
Well, first of all, bullet deflection usually occurs only in the heavier bones or when the bullet is at a severe angle to the bone, so that it doesn't actually penetrate it, it deflects off of it. In this case, I traced the path of the bullets in all three cases, from the entrance to the exit, through the organs and tissues that the bullet went through. There's no indication that it went other than a straight line through the body. And the bones that were perforated, ribs and sternum, were not the kind of bones usually associated with bullet deflection. There's no indication that they were deflected, they just went straight through the bone.
And that would be the same for the scapula or the shoulder blade that was penetrated?
Yes, the scapula is actually very thin in that area that it went through.
Thank you. No further questions. Recross.
You indicated there was an abrasion on Mr. Broderick's ankle, is that correct?
There was, I don't know that I specifically mentioned that before.
Okay, but one of the abrasions that when you said you saw an abrasion, one of them was on his ankle, is that correct?
Yes.
And that was one of the fresh abrasions?
Yes.
Okay. And you were not able to give any time limit, whether it was an hour, 2 hours, 4 hours, were you?
No.
And it's possible that, for instance, an abrasion might have came from hitting the nightstand when he fell off the bed.
It's possible, sure.
Now, also, you testified that you are a medical doctor, is that correct?
Yes.
Okay. So terms to you are fairly specific, aren't they? I mean,
Generally speaking, yes.
okay. So there's a difference between somebody falling in momentum and just all of a sudden falling and moving their legs and taking a couple of steps, isn't there? I mean, that's muscular movement. It takes a fair amount of muscular movements, muscles pulling and muscles going, for a foot to go from front to back, doesn't it?
Yes.
Okay. So you're not saying now, you're not denying the fact that somebody can get shot in that area and still take 1 or 2 steps, are you?
No, I wasn't trying to deny that.
Okay. You indicated that there was another photograph of larger magnification. Did you bring that photograph with you?
I don't believe that was his testimony. Can I answer the question?
No,
Did you, last night when you got off the stand, did you have a meeting with the district attorney?
I talked to the DA as we were leaving.
Did the district attorney show you any photographs that would be a smaller photograph than this, but larger magnification?
No,
Did you go look in your materials for a photograph that was smaller than that, but of larger magnification, so you could show it to us?
no, I don't have possession of any such photos.
Okay. And as a doctor, I take it that in the field of pathology, the best evidence that lets you see what a wound is actually examining the body.
Which one, Fuddletown? Which one? Because I think I'd rather listen to Dr. Swalwell talk than this attorney. Because I don't know why they're arguing about this. I really don't. The current lawyer. Yeah, I don't know why the state had to redirect about it. I have no idea. It doesn't matter. They're not here. She was there. I don't understand. But maybe you were right, Palatine. Maybe it was for maximum penalty. I have no idea because they didn't go, well, California, I don't know if they had capital punishment at that time. I can never keep up with when they have it and when they don't.
Body itself, rather than looking at photographs, isn't it?
Yes,
Okay. And in this case, I take it, examined the body before you came and testified, did you? Sometime in the past, you've examined this body.
right, at the time I did the autopsy, sure.
Okay. And at the time of the autopsy, one of the functions of a forensic pathologist is to look at wounds and make some determinations as whether it's a through and through wound, whether it was one that broke the skin, whether the bullet's been removed some other way. That's one of the functions of a forensic pathologist, isn't it?
Yes,
Okay, so when you examine the body itself, that's one of the things that you have in mind so that you can give an opinion as to whether it's a through and through or whether it's the kind of wound where the bullet might have lodged and came out sometime later. Is that correct?
yes, except for the fact that I'm not aware of any criteria to distinguish the two, just based on the observation of the wound.
Well, you testified, though, at a prior hearing that it was a through and through, didn't you?
Yes, and I'm not denying that.
Okay. And, well, you didn't say it could be a through and through. You said, in your opinion, this was a through and through wound with the bullet continuing to travel. That was your words, weren't they?
No, that was the question.
You answered yes.
And I said yes because it was posed as an either or. Either that or it made a small tear and came out at a later point in time.
And so then you had those both choices at the time and you picked a through and through wound. Is that correct?
Yes,
And now you're saying that the pictures that you looked at, that you haven't found yet, right? You haven't seen those pictures again.
no, I haven't seen any again.
Those pictures gave you a different impression and a different answer than the evidence that you had from viewing the body itself.
No, I didn't say that. I said in discussing it and looking at pictures that another possibility came up, and I didn't want to imply that that was not possible.
Who did you discuss it with?
This was a discussion with the DA and another forensic expert,
Who's the other forensic expert?
Mr. Paul Dougherty.
And when did this discussion take place?
Oh, this was sometime this summer. I don't remember the exact date.
Your Honor, again, I would ask if we could have the picture produced so that I can ask them. Your Honor, he has the picture.
You
There's no
said
different
yesterday, as long as it was same, not yesterday for us, yesterday for them, as long as it was the same picture, you were okay with it. So don't be asking about it now, sir. Sit down. You had your chance. Shh, just shush. It doesn't matter. Unless somebody can tell me. If somebody knows why this matters, then tell me. Because I don't care to be wrong. If I'm wrong, it's okay. It's all right. But he had his chance. He said, no, it's fine. Yesterday, back in the 90s for them, yes. But that's annoying. That's annoying because he said, I don't care. When the guy said, it's the same picture. Oh, well, that's fine. I don't need them. Yeah, fine. Okay, good. Bye. Now you want to bring it back up? I don't think it's going to work. Boy, this went by fast today.
He's testified that there's a different picture.
Yes. Go ahead,
We
Ms.
can
Swalwell.
approach that one.
Sure.
Just bring the
We're
picture.
willing to give any pictures to council.
Now, again, Dr. Swalwell, I hate to belabor this point, but photograph, again, is what's shown here in B of people's money, as you saw, right?
Yes.
And it might have been trimmed down, and it might have been somewhat larger, but we're not talking about a different view, different angle, different wound. We're talking about this particular negative. Is that correct?
Right. The photograph was a different size, but whether the magnification was different from this particular one, I couldn't say.
Now, in the last hearing that we had in this matter, when the defense lawyer asked you an either/or question, he gave you two possible responses. Did that cause some difficulty for you?
At the time,
At any time?
well, as I said later on, I realized that might have been misleading.
Why would it be misleading?
Well, because it's an either/or question and didn't consider all the possibilities happen.
Okay, can you answer his question now fully and completely?
Well, I'll just reiterate what I said earlier. It's obvious that the bullet came out at some point in time. This is an exit wound. It's not a small wound as far as gunshot wounds go. It is most likely that the bullet went through and it continued on, but it's also a possibility that the bullet hung up on the skin as it was coming out and didn't come out right away, that it may have come out a short time thereafter.
And as a forensic pathologist, you've seen that happen in small percentage of cases?
Yes, this is a rather fairly rare phenomenon. I mean, most gunshot wounds, they either go all the way through or they stay in the body.
And the choice they gave you in the last hearing that it either came all the way through and kept on going, or caused only a small tear and came out at a later time. Why would that second alternative not be a good one?
Well, I mean, the reason why I responded that way is because I don't consider this a small tear. So obviously that wasn't correct.
So you looked at photograph B and this does not appear to be a small tear.
No, it's a half an inch long. I don't consider that small, although it's narrow.
Thank you.
Thank you very much.
Oh my gosh. Why have all these witnesses just been like torture? All of them. Oh, let's get rid of the banner. Don't need it. I will say this. Oh no. Right. You missed the dumbest questions. he was just talking about, how do you know, like, this was the fatal one? Or, I mean, obviously he doesn't know which one hit first or second or whatever, but it was like, how do you know? And what if they lived for like 2 more minutes? It doesn't matter. She pulled the phone out of the wall. What's he gonna do? Linda couldn't move because she was gone. And even if he was able, he'd crawl to the phone. Well, she ripped it out of the wall, allegedly. Oh my gosh. You're sad you missed the cavity, sir. The mannequins were the best part of the testimony for the day. That's all. Nah, I can't tell if I don't know what's happening. Now I can't read chat. But yeah, the mannequins are the best. Because everything else didn't make any difference. It doesn't prove whether she's guilty or she's not guilty. It really had nothing to do with her guilt or innocence, in my opinion. But I don't know. That's just me. If I was a juror sitting over there, I'd be like, why are you guys arguing about this? This doesn't matter. In the whole big picture. It's not. Hey, I have been up late every night. Thank you very much. But I also would like to have a conversation with the man I married before I go to bed. I have seen him for like 5 minutes for the past week because we've just been like 2 ships passing in the night. And he's actually home. So I was glad that today was I don't know what I know. I've got to get a new one. I've been looking at new ones. I need to get new ones. Yeah, Flash Fan, where'd you go? Go eat or something? Yeah, it would only strengthen the bonds. Well, there's a point. Then it's like, yes, I need to get a new camera and my light that has been very fickle here lately. If I unplug it, it won't turn back on. But if the power goes out while it's plugged in, I also have to unplug it for a few days, and then it'll turn back on. But now it's just decided it's just not gonna turn back on. No, but I do need I need stuff. I need stuff. Also, I mean, it's like really humid here, but I don't think that it's humid in my house. I don't know. I do not have an OnlyFans. You are correct. And I will not go towards the light. And it's not my beauty filter. I wish. It's just keep me blurry so you can't see anything. That's my plan. That's my plan. I just will never be fully in focus. But also, it's driving me crazy because now I can see it. I messed with my camera between the last stream and this stream, and now it's just been like, sometimes if I do that, it'll come back into focus. I don't know what's the deal. What's the deal? So when we reconvene, yeah, I know it can, but I don't think it is. It could be. It's stormy here. But I wouldn't think it would be so humid that it would be fogging my camera. I have no idea. I just need a new one. Lots of okay. I have not been touching the lens. but maybe I should just try to wipe it off anyway. But I promise I've not touched it. So when we reconvene on Monday, we will hear from the oldest daughter, and I think that'll probably be the only time that I will be interested in hearing what the defense attorney has, his questions, because they might actually, maybe he'll have some good ones. Doubt it, but he might. I don't know. And I know he's doing the best with what he has, and he doesn't have anything. A dare. Thank you. Yes, Puddletown. I need to pay attention to him. But I am looking, so we won't get to, let's see. So it looks like Monday and Tuesday, let's see, sorry. Monday will be direct of Kim Broderick. Tuesday will be the out of order divorce attorney. You're out of order. And then Thursday, I know this will shock you that it'll take us 2 days to get through cross. So Thursday and then the following Monday will be cross-examination of Kim Broderick. So I know that'll shock you. And they are a lot longer days than this one was, because that's why I'm not going on, because this was about an hour and a half, and I think, let me see what her first video is. I think it's well over 2 hours. Yeah, it's almost, her first day is 3 hours, just under 3 hours. So that's going to be a longer stream. So that's why I'm not starting it tonight. I don't know. I don't even know what I don't say, Gabby. I have no idea. I think that's all I have. Well, thanks for being you, little one. Thanks for showing up. I appreciate it. Appreciate everyone that shows up and spends time with me. So I don't have to sit and talk to myself, which I've done. It's fine. Makes talking to myself all the time more normal. But so that's the plan. Is we'll be Puddletown, you're just fine. I just don't want any of your Kit Kat because I don't like Kit Kats. So, but thanks for trying to share with the class. I'm sure they appreciate it. Oh, see, now you guys are just being too nice. Shame. But anyway, enjoy the rest of your evening. Enjoy your weekend. Happy Mother's Day to all the mothers out there. Any type of mom you are, I better change and not use the word mothers, because some of you will put bad words at the end of those. Hey, Shenny, how you doing? Hope you are doing well and enjoying your Thursday. It's Thursday. So yes, I'm looking forward to seeing what the daughter has to say. We get 2 of the daughters. We get Lee and we get Kim. So I'm looking forward to that. I think. I hope I may be let down. I don't know. I'm with you, little one. That I don't have my mom is gone, but I still celebrate her. And actually, my husband and I both. His mom passed away in last October. So between the 2 of us, we have my dad left. I feel like we're too young for that. But anyway, we're not going deep. And I'm going to throw my camera across the room in a minute. So there's that. But anyway, 5:30 Monday. If I don't think that I can. If I can maybe start a little earlier, might. If that doesn't throw anybody off, because it's going to be at least 3 hours, but I don't have to. 5:30 is fine. I don't care. I just probably won't stop much. I'll try not to stop much, because anytime I say I'm not going to stop much, I stop every 5 seconds. But I'll just show you her. I'm not going to play it. I'll just show you what she looks like. Just the attitude that she's bringing to the stand. That's what we're starting with Monday. Doesn't she just look ready to go? Like, oh, I don't know if I can do 4:30. I was thinking 5. I don't know that I can start at 4:30. I'll probably just leave it at regular time, because it's actually it's working. And you know what they say, if it ain't broke, don't fix it. But yeah, that face, that is the look of ready. She's ready. So that's what we'll be seeing on Monday. And buckle in. I don't know, might be boring. I have no idea. But I'm looking forward to getting into this testimony of the daughters, the friends, the attorneys, everybody that had actual dealings with her, and get out of the law enforcement stuff. Generally, I want to hear the medical examiner, because they tell us a lot of stuff. He did tell it. His was pretty straightforward till they got all sidetracked on what was doing. What was he doing? Well, he was dying. I'm past the 2-hour mark. Yes, Gabby, we know you love 5. But yeah, I was thinking out loud. It's just going to be 5:30 unless something really weird happens. You went to bed last night, told yourself that this was going to be Thursday. I'm with you, Haley. I'm with you. All right. See you, little one. Have a great weekend. All right, guys. That's all I got. I know. I can't help it. I put it out there. It's out there now. Sorry. But all right, I'm really ending this time. All right. I'm sure I'll see around in chats, and see you Monday evening. Yeah, it's way too early to send you to grandma's. All right. See you. Bye.